And here's a powerful reason that you should have the flu needle this year. A Canadian study into the link between influenza and heart attacks. Jeff Kwong is at the University of Toronto.
We've long suspected that there is an association between influenza and heart attacks, but it's never been confirmed. So we've kind of had circumstantial evidence that, during flu seasons we see more people dying of heart attacks. But this is the first time that we've had lab confirmation that these people actually had lab-confirmed influenza and then had a heart attack.
What did you do in the study?
We gathered up a whole bunch of data from a bunch of laboratories, and we saw who was tested for influenza, and we linked all those data to hospitalization records. So we can see all the people who had confirmed cases of influenza and had a heart attack. And all we did was we looked at the timing of when the heart attack occurred relative to when they were diagnosed with influenza.
Within a week?
That's right. So we saw that there was a 6-fold increase in the risk of a heart attack during the week right after being diagnosed with influenza through the lab test compared to the 1 year before or the 1 year after.
Did you have a sneak peek at the 14-day number to see whether that dropped dramatically?
We did look at after the 8 to 14 days, we saw that there was no more risk, and also 15 to 28 days. So it wasn't like there was a gradual decrease in the risk. It was a sudden spike for 1 week and then disappeared after that.
Still doesn't mean it's cause and effect.
Well, it's a pretty strong association. A 6-fold association is quite strong. I mean, to put that into context, the association between smoking and lung cancer is 5-point-something. So for this association, it's pretty strong.
Did it affect some people more than others?
So we did do some subgroup analyses where we looked to see if age group was a factor. And so there's suggestions that there's a stronger risk for those who are over 65 compared to those under 65. But we know that people who are over 65 are at greater risk of having heart attacks to begin with. And it's possible that the influenza could have more of an effect on those people.
How many flu seasons did you look at?
We used data from 2009 to 2014, 5 seasons.
Now, the influenza virus would have changed during that time. Were some influenza viruses more potently associated with heart attack than others?
Yeah, we looked at that as well. So we did divide it into influenza A and influenza B. And then we also divided the influenza A's further into the H3N2 and the H1N1 subtypes. And we did see the suggestion of a higher association for influenza B compared to A.
Some people get the flu even though they've been immunised. Was there any relationship between those who got influenza and had been immunised and the risk of a heart attack?
Yeah, so we did look at that, and we did see that there was an association, even for those who are vaccinated. So what that means is that people, they may have been vaccinated, but not everyone who's vaccinated is going to be protected. So there's always some people who will still get influenza. And so if you do get influenza, you still are at an increased risk of having a heart attack, similar to those who are not vaccinated. But that doesn't mean that influenza vaccines don't work in general. It's just that for those people, it didn't work for them, and then they were still at risk of having a heart attack.
So let's assume that it's cause and effect. 6 times the risk is actually a pretty significant risk. However, does it translate to large numbers? Is this a significant public health problem?
That's a very good question. And the issue with our study was that we only included people who were tested for influenza. And so the issue is that a lot of people get influenza infection. They may or may not get very sick. And so people who are not very sick, they might stay at home. It's only people who are sick enough to actually go see a doctor, and then they're sick enough that they get tested for influenza. Those are the people that are included in this study. So the 6-fold increase really only applies to that population. And whether, the risk for those who are not so sick, the risk of having a heart attack in those people, we can't really answer from this study.
364 hospitalizations for acute heart attack over, 5 years in the province of Ontario, which is, 14 million people. So, grossed up for, double that for Canada. Mm-hmm. So those are the kind of numbers, and what you're suggesting is that there may be an iceberg phenomenon of people there with milder disease, but we don't know that yet. Why would the influenza virus cause a heart attack?
Well, we know that infections in general cause inflammation, and inflammation can lead to damage to the inner lining of the blood vessels that serve the heart, and it can increase the chances of blood clots forming through like activation of the platelets, the cells that cause blood clots. It can also be a stressor on the heart because infections can lower the amount of oxygen in the blood, can lower your blood pressure. And so to compensate for all of that, the heart has to beat faster, and then that extra strain can be what tips people over to have a heart attack.
What's to be done about it, apart from immunisation and reducing the burden of influenza? What else can you do?
Obviously, the first thing is immunization. Even though the influenza vaccine is not perfect, getting some protection is better than no protection. But secondly, I think washing hands frequently is a good idea because it's not just influenza virus that are increased the chance of heart attack, but other viruses as well. In our study, we found that other viruses such as respiratory syncytial virus and a whole host of other viruses also increase the chance of heart attacks, only about threefold, not as much as influenza, but still those ones we don't have a vaccine for, so it's best to wash your hands frequently to prevent getting those infections. And
if you get the flu, you just quiver in fear, or what?
Well, I think the best thing to do is for people to stay if take it easy. If you're at increased risk of having a heart attack, not to exert yourself too much. Drink fluids to prevent dehydration. And if you are having symptoms that are suggestive of a heart attack, chest pain or trouble breathing, then it's probably best to go seek medical attention.
So there's no evidence of really what you can do. You shouldn't be swallowing aspirin, for example, if you're not already on aspirin.
I would say that we don't have evidence for that. I mean, you can infer that it might be a good idea to take some aspirin, but there's also potential risks from taking aspirin, such as bleeds in the stomach or gastrointestinal tract. So a little hesitant to make a blanket recommendation for that until we have evidence. People who are at high risk of heart attacks, a lot of them are recommended to be taking aspirin on a daily basis anyway, although the pendulum's kind of swung back and forth.
So the message is prevent influenza, prevent coronary heart disease, and take 2 paracetamol and see me in the morning.
Yeah.
Thanks very much, Jeff.
Okay, thanks a lot, Norman.
Jeff Kwong of the University of Toronto and Public Health Ontario. You've been listening to The Health Report. I'm Norman Swan, and I do hope you can join us next week.